My name is Ahmed Farag, and I'm a cardiologist working here in Cheshire and Merseyside. I want to speak to you today about something that's extremely important when it comes to taking care of your heart health, and that's your blood pressure. High blood pressure affects 1 in 4 of us adults here in the UK, and it's termed the silent killer because it doesn't have any symptoms. And the problem is that the high blood pressure then affects your heart, affects the kidneys, it causes dementia, it causes strokes, and it's largely preventable, and that's the important thing. And this prevention all starts by knowing your numbers, and that's extremely important. So what's know your numbers? This is about finding out what your blood pressure is, and you can get this checked either at your GP surgery, at your local pharmacy, or you can purchase a blood pressure machine to check your blood pressure at home. And the magic number you're looking for is 140/90. So you need your blood pressure to be below these numbers. If it is high, then you can do things about it. Obviously, we can give you medications, your GP, your pharmacy can give you medications, your cardiologist can give you medications for it. But the important thing is that there's lifestyle changes that you can introduce that affects your blood pressure. So what are these changes that you can do yourself? One is eating healthy. This involves plenty of fruits, plenty of fiber, plenty of vegetables, drinking water, and staying away as much as you can from processed foods, from takeaways, from salty snacks. This is very important because it does affect your blood pressure. The other thing you can do is reducing the amount of alcohol that you can drink, because we know that excess alcohol affects your blood pressure and elevates it. You can also stop smoking if you do smoke. That's extremely important, and that's one of the best things you can probably do to help yourself is by stopping smoking if you do smoke. The other important thing you can do is by exercising. And with exercise, there's two important things that I want you to focus on. One is by doing physical activity and exercise. And the good thing about exercise is that any exercise is better than none. So there's two different things I want you to focus on. One is that I want you to exercise, but equally I want you to reduce as much as you can the amount of inactivity, i.e. sitting idle at your desk or watching the TV or sat in your chair. I want you to try and interrupt any prolonged periods of sitting by doing some light exercise, even by standing and walking around the room. I want you to do that because we know that this is also important when it comes to heart health. So even small changes you do to your blood pressure to reduce it, you're going to have a massive impact about protecting your heart, protecting your brain, protecting the kidneys, and that's very important. And it all starts by you knowing your numbers and by checking what it is. Right? I hope that you find this message helpful. And if you do have a good blood pressure, or your blood pressure within normal, speak to your friends, speak to your family, and try and get them to check their numbers as well. Thank you very much for having me.